Ladies and gentlemen, I am going to tell you something about discharging years. I worked in the MAYO hospital Lahore for a long time in various capacities as a registrar, senior registrar, assistant professor, associate professor. In the outdoor, when I used to sit, the people used to come with two problems, deafness and discharge. Especially in this rainy season, discharge is very common. The smaller children, they get victim due to tonsillitis problem. This was our first national E.N.T conference for which I met General Ziaul there in Islamabad, and then he was very kind. He came on my invitation, especially from Islamabad to the airport of Lahore. Then from airport to straight away to this Hawaii hotel, which used to be called as Hilton Hotel at that time. It was a big event for the E.N.T specialist and the first breakthrough for the E.N.T specialty. It was the first national E.N.T conference, presided by the topmost and the strongest man of the time, Chief Marshal Administrator General Muhammad Ziaul, President of Pakistan. He was sitting there along with Lieutenant General Ghulam Jilani Khan, along with Dr. Nasiruddin Jogazai, Federal Minister of Health. The top brass was there. It was for the, humanity, that how E.N.T can be uplifted in Pakistan. We should not have the need to go abroad or anywhere for the treatment. The treatment should be there within the country and it should be available to the masses. He gave very good speech and then he said that there should be E.N.T specialists. It was my demand that E.N.T specialists should be at the level of district also. There was no E.N.T specialist in the 81 at any district. Either, of course, maybe it's Sigoda, maybe it's Saiwal, it's Sialkot or Rahimyar. However, the E.N.T specialty got a lot of support, and then due to that, now we have got, E.N.T specialists available. He then said that there should be E.N.T diagnostic centers also for deafness. But I am focusing now myself to the ear discharge. Ear discharge mostly takes place in the children due to the tonsillar problems. And if they have got a central perforation, the tonsillectomy operation is going to do the cause. Because in smaller children, we cannot go towards the mastoid surgery. If there is a special indication of saying as central perforation of the ear, if it is there in a child, it responds to tonsillectomy operation. Because if you remove the tonsil, the ear discharge becomes okay. Then I represented Pakistan there in New Delhi and I did the inauguration of the 5th SAARC E.N.T conference. After that, there was a scientific session. I chaired that. One lecture was on this again, discharging ear, because it's very common. Delhi is like Lahore. The people here, the people there, atmosphere, climate, living standard, almost same. Then they said that we should solve the problem, that why there is a discharging ears. It's a very bad thing. Sometimes this discharging ear can cause, even if not discharging outside, then the infection start going to traveling towards the cranium, that is called inside the brain, causing intracranial complications, which are grave complications, can lead to the death of the patient. It's not a simple thing, however. Then in adult, we do the mastectomy operations. There is a radical mastectomy, there is a modified radical mastectomy, there is a cortical mastectomy. These are the various varieties of operations which we perform during the ear discharge. For this, there was a special lecture there in Egypt, in Cairo, in the World E.N.T conference. Because this problem is quite common there in Cairo, in Egypt, in all of those African countries. If you go, the same problem here in Pakistan also. I have gone to Sri Lanka, problem was there. I have gone to Dhaka, the ear discharging topic was heated discussions. But in Cairo, there was a state-of-art lecture that ear discharge should be taken seriously. It should not be left to the patient. It just you give few drops and then some antibiotic and send the patient. Properly investigate the patient. Do assessment and evaluation whether that patient is a candidate for mastectomy operation. Then go for that mastoid surgery. It is going to save the patient. Otherwise, patient can go. The same thing which I then had a lot of discussion there in Dhaka, then also in Kathmandu, Nepal. We have got the second SAARC E.N.T conference. There were speakers from Bangladesh, from Sri Lanka. They spoke very well and they did a lot of discussion. And ultimately, the result was that we should promptly assess and evaluate. The patient should not be left with small medicine and drops and send him to the home and then don't ask. If he does not come, then he will come with a bigger complication that he is going to have the intracranial complication. That is, discharge was coming out has started going inside the brain. I am not making you horrified, but it's the fact. Ear discharge is alarming situation, especially when I had to organize this conference, 10th International E.N.T conference in Lahore, also PCOT. As an organizing secretary, there were lot of papers they were read. But the ear problems should be always be taken more seriously and promptly. Then there was a conference there in New York, in the Jacob Convention Center, where the delegates, especially from South Asia, from India, Pakistan, Bangladesh, because there is a hard humid atmosphere here. Ear discharging problem is more here than Europe or America. So all the paper, they were concentrated on one point, that ear discharge should be taken seriously, sincerely. It should have a proper follow-up and then it should be managed. Thank you very much.